and today we will demonstrate how to conduct a range of motion assessment for shoulder flexion and extension. The shoulder is a ball and socket joint which is multi-axial. The movements of shoulder flexion and extension occur in the sagittal plane and on the frontal axis. When conducting an active range of motion assessment, the client may start in either the sitting position or the lying position. The arm should be at the side with the palm facing medially. For the purpose of this demonstration, the client will start in the sitting position. However, the assessment should be performed in the lying position if the patient has difficulty maintaining balance in a seated position, as in the case of a severe stroke or a spinal injury, for example. The weight of the trunk is the stabilizer, and the scapula should be left free to move. The therapist should place the axis of the goniometer at the lateral aspect of the center of the humeral head, about 2.5 centimeters inferior to the lateral aspect of the acromion process, with the stationary arm parallel to the lateral midline of the trunk and the movable arm parallel to the longitudinal axis of the humerus. The client should move the humerus in an anterior and upward direction to the limit of motion. Sarah's active range of motion is from 0 to 170 degrees, which is within the normal range of 0 to 180. In order to assess passive range of motion, the therapist should move the arm a little further than the client's active range. Sarah's passive range of motion is from 0 to 175 degrees. For the purpose of this assessment, the client may start in either the seated position or the prone position. The arm would still be at the side with the palm facing medially. For the purpose of this demonstration, the client will start in the prone position. The therapist should place the axis of the goniometer at the lateral aspect of the center of the humeral head, about 2.5 centimeters inferior to the lateral aspect of the acromion process, with the stationary arm parallel to the lateral midline of the trunk and the movable arm parallel to the longitudinal axis of the humerus, pointing toward the lateral epicondyle of the humerus. The therapist's forearm could be used in stabilizing the scapula. The client would move the humerus posteriorly. There you go. All right. And then in order to assess passive range of motion, the therapist would push the client's arm a little further than their active range. All right, Sarah's active range of motion was from 0 to 45 degrees, which is within the normal range of 0 to 60 degrees. Her passive range of motion was 0 to 52 degrees.
Today, I will be demonstrating how to perform range of motion assessment for shoulder internal rotation. The purpose of range of motion assessment is to determine if there are any limitations that interfere with functions of daily living. The shoulder joint is a synovial ball and socket joint. Shoulder internal rotation occurs in the transverse plane on the vertical axis. The start position, the patient is prone. The shoulder is 90 degrees abducted. The elbow is flexed at 90 degrees, and the forearm is in mid-position. A towel is placed under the humerus to achieve the abducted position. This start position is contraindicated if the patient has a history of posterior dislocation of the glenohumeral joint. The goniometer would be placed on the axis of the acromion process of the arm. The stationary arm is perpendicular to the floor. The movable arm will be parallel to the longitudinal axis of the arm, pointing toward the ulnar styloid process. What I will do is have the patient move the palm of her hand toward the ceiling. Okay. Here we have 0 to 65 degrees of active range of motion. Now what I will do is I will push the patient's arm a little more. Here we have achieved 0 to 70 degrees of passive range of motion.
I will be performing the range of motion for external rotation of the shoulder joint. The shoulder joint is a ball and socket joint with a multi-dimensional axis. External rotation moves along a transverse plane in the vertical axis. Full range of motion for external rotation is 0 to 90 degrees. The purpose of assessing this is to see if there will be any limit. To perform the range of motion for external rotation of the shoulder joint, you will have the patient start in a supine position with a towel under the scapula. The start position is contraindicated if the patient has a history of anterior dislocation of the shoulder joint. The patient will start with the shoulder in 90 degrees of abduction, the elbow flexed to 90 degrees, and the forearm vertical to the floor. The therapist will first observe range of motion by having the patient move the dorsum of the hand toward the floor until scapular movement first occurs. So first let me have you move your hand towards me. Good. And then back up to neutral. So then to measure the range of motion, I'm going to have the axis of the goniometer at the electrodynamic process of the ulna with the stationary arm perpendicular to the floor, and then the movable arm parallel to the longitudinal axis of the ulna and pointed towards the styloid process of the ulna. So first, we will have the patient move in that same position, moving your hand towards me. So I'll measure first the active range of motion to about 73, and then I'm going to move you a little bit more. Tell me if it hurts. And then here we've got it about to 85 degrees. So that's about at full range of motion.